Hello, my name is Ben Schuff. I'm a naturopathic doctor and dietitian nutritionist. I'm the clinic director of Whole Systems Healthcare Chicago and the medical education director of the organization. Today, I will discuss with you how a certain mindset has disconnected us from ourselves and the environment around us, and a case for integrating the notion of the terrain into healthcare. I will also discuss a helpful tool called the Healthcare Continuum and how COVID-19 is one example of a larger pattern of how we tend to handle problems in our society. The paradox of progress in medicine despite increasing chronic diseases, and how we can reintroduce medicine to proactive and terrain-based approaches to improve on a concept called Healthspan versus extending lifespan. So let me start with an observation. During the COVID-19 crisis, we're able to go get groceries. And something that I've noticed on occasion when I enter a grocery store is they are in a rush, their face is covered, gloves on, keeping their social distance, which is totally reasonable. But someone practicing these measures while at the same time having a cart full of junk food gets me wondering, how can it be that one simultaneously is fearful and cautious of a virus outside of themselves while also not being cautious of the food that nourishes the body, the host for that virus? Whether it's not knowing what a nutritious food is versus an empty one, or how to prepare food adequately, or just a deliberate apathy for the quality of food consumed, it's all just one example of a larger pattern, that there's a disconnect between our health, our behavior, our environment, and disease. So let's talk about it. So to implement the public health measures that we're all doing, the social distancing, the quarantine, is appropriate and necessary. But what about individual health measures? We tend to have a mindset that factors separate from ourselves are the most important. We fear the unfamiliar and we create enemies. Then these problems are dealt with by other people or other systems, including doctors and politicians, companies, systems, etc. We create a situation where we fear others, the environment around us, a virus, human contact, some enemy, while simultaneously relying on others to solve problems for us. And this type of disconnect puts us at risk of forfeiting the significant power we have to determine our own health destiny. So what I'd like to talk with you about today is how this frame of mind has come to be, how it has continued, its effect on our health, and what we can do about it. But first, I want to introduce the concept of the healthcare continuum to put into context and help us understand where this disconnected mindset fits in. The healthcare continuum is a model developed by Craig Merman at Whole Systems Healthcare that provides a framework for understanding the various roles and philosophies that exist across the spectrum of medicine. And this is what it looks like. So the healthcare continuum allows for a visualization of the scope of healthcare, from approaching acute problems to restoring someone's health. The reactive approach to health makes up most of the left side of the healthcare continuum, which tends to manage acute issues, the overall wellness of something we call the terrain, which we'll talk a lot about later. Each side should ultimately support the other side. And for the provider using the healthcare continuum, its value is in them realizing the lens and value of their own approach, whether it's reactive or proactive. And for the patient, this model helps them understand what the approach they are using is attempting to accomplish with its given therapy, whether it's reactive, proactive, or both. And what we will see is that when we don't utilize the full spectrum of the healthcare continuum, it makes our possibilities quite shallow, leading to a lot of shoulder shrugs or idiopathic diagnoses. And idiopathic is a problem of unknown origin. So that leads into how we handle problems that we understand, health problems we understand. So this crisis, COVID-19, is a good example of the type of response that our society in general has to problems we face in regards to health. We have a reactive and combative approach when there is a clear enemy. This is not at all to say that COVID-19 should not be responded to or that it's not important. COVID-19 is a contagious virus that has the potential to put those vulnerable into life-threatening situations. The intention of this presentation is not to downplay this at all. The point here is to highlight that the incredible situation we find ourselves in is a reflection of a larger pattern that we as a culture and society have employed for at least 100 years. Our problems aren't necessarily difficult to solve. It's more of a disagreement on how to get there. Thus, it stalls our efforts. We are seeing a time of relatively nationwide solidarity, like the months following September 11th, for instance, because the path forward seems so obvious. We seem to have a clear cause and a clear enemy in plain sight, in this case, the virus. So we handle that with as much force as necessary just to get the job done. A pandemic is something we can all seem to rally on because finally we have a problem that has a plan. And this is the reactive mode, the red on the healthcare continuum, that mode of medicine. So now let's contrast that to the other side, health problems that we don't understand as well, or what we call the intractables. So consider for a moment the nature of the majority of our biggest ongoing problems in regards to health. They are relatively intractable problems. Intractable problems are those that don't have as clear of origins and are hard to control. Think of addiction, depression, autoimmunity, obesity, diabetes, metabolic syndromes, chronic pain, mental health issues, just to name a few. We simply don't know how to solve them with satisfaction by reducing them to just the facts or implementing control, like managing symptoms, suppressing symptoms, or even ignoring symptoms. And though they call COVID-19 an invisible enemy, a virus is a tangible entity, especially relative to the intractables. It has observable, measurable effects, a distribution, a spread that allows us to track it and forcibly act against it. And how we think about something is reflected in the language we use to describe it. And the language we use for situation and beyond is that of violent in nature. It plots us against the virus in warlike terms, from wartime manufacturing to methods of warfare in an effort to defeat the virus. The mindset creates a feeling that we are separate from it, like we're disconnected from the virus, our body and the relationship between the two, that we're not part of nature. And we'll discuss the origins of this phenomenon. But on the bright side, this crisis is showing us the power of our cohesiveness when we come together to deal with collective problems. However, we have to ask ourselves why our world is so suddenly changed from this particular situation in such a swift fashion. It has to do with how our systems are designed to react in the first place. And as I mentioned, our world is not absent of dire problems to solve, affecting millions of people. Viruses like COVID-19 being one of those for sure. When we compare problems such as viruses, injuries, UTIs even, to issues like suicide from mental health issues, obesity, autoimmunity, chronic pain, opioid overdosing, homelessness, hunger, extreme poverty, environmental collapse, so on, we see a stark difference in how we would deal with a more tangible, straightforward problem like a bug or an injury versus something more intractable like the feeling of depression. And the societal implications of such problems span multiple related fields. And here's where we start to see a theme, a pattern that we can identify. Our systems across healthcare professionals are oriented towards a relatively common approach of standardization, keeping things under control and reducing complex problems to the simplest components possible, and then acting on those. Seems rational enough. So we can think of it like this. The more observable, the more measurable and seemingly straightforward a problem is, the easier it is to implement the dominant response of control and fighting, which works well for acute situations like emergencies and life-threatening circumstances. The trouble with the fighting approach comes when we are considering these intractable, long-term, chronic problems. With the same mentality, we tend to leave out the consideration of much of the ground conditions, the terrain, that created the problems in the first place, the root causes. Root causes are the focus of the proactive or green area of the healthcare continuum. And put simply, we do not know what to do for intractable problems through the reactive model because our go-to responses, those of combativeness and control, are not effective long-term against problems that develop out of unique, relatively unpredictable, and non-linear origins. So what is it about COVID-19? COVID-19 presents us with a contagious pandemic, and our prime system that I just described springs into action with its reactive mode of control and management. So we're seeing lockdowns, quarantines, isolation, hand washing, control of movement and information. It's operating through its known mechanisms. The cause and effect of a virus can be quantified and tracked. It can be demonstrated whether what we're doing is efficacious or not. And as author Charles Eisenstein says, COVID-19 presents us with a challenge that we can conceptually meet and offers a plan of action. And enthusiastically so in a world of growing uncertainty and bewilderment of how to face these intractable problems that I mentioned. And what we do know how to do very well is to control, measure, and fight. And it's important to say that an approach of control is not inherently incorrect. Instead, its potential damage comes from it being the presumed only approach and thus widely applied to many situations when it's either not sufficient to address root causes or even appropriate. We have to understand that this mode is just one way to solve problems. So to review, the particular health situation, COVID-19 that we're dealing with, may have happened in the way that it has because we have a mindset that health issues are separate from us. Therefore, a pandemic requires a response that fits this mindset because it presents us with a plan which will be successful. And in contrast, there are many widespread intractable issues that still persist because the same mindset does not address the core issues of the problem as well as a method of problem solving. So this exact contrast in problem solving is how a disconnection between our bodies, our health, disease, and the systems that we rely on develops. The problem and the solution are placed outside of ourselves. The disconnection creates a feeling of powerlessness, and it creates a paradox, which we'll now describe. So the paradox of medical progress with regress of chronic diseases. So despite the incredible progress of medical research and advances in treatment, we have not gotten to be a healthier country over the past few decades. On the contrary, we've actually seen a significant increase in chronic diseases, and at least in the United States, a plateauing then decline in life expectancy. We're so tilted towards our go-to responses on the reactive side of the continuum, some version of control, that we simply aren't addressing core problems, root causes in a sufficient way. And what we have to understand in context is that medicine, conventional medicine, how we think of it, became a prestigious and awe-inspiring profession in the 20th century exactly because it seemed so heroic. The development of antibiotics, surgery, vaccinations, immunosuppressants, steroids, public health measures such as sanitation and water purification. The short-term miracles and solutions that these produce for society's greatest scourges led us to believe that with just a little more effort down this path, one day disease would be a thing of the past. We would solve disease. And then this was incredible in the context of the 20th century. Solving infections, otherwise going towards sepsis and death, surgical advances which saved lives, antiseptic techniques which significantly diminish complications following surgeries, and vaccines seemed to tame nature herself. We were on the express train to medical utopia where we were going to solve it all. But if you've been following the thread of thought that I've had, the flaw in this heroic type of medicine is that it addresses disease by fighting it, and it claims to be the only rational path. It wants to learn about disease and then use some technique, whether it's a specific drug or procedure, to push right in the other direction. It seems like this approach is not as interested in the human being, even if it's the apparent subject. It's fixated on the smallest levels and can sometimes lose the forest and the trees. When the focus is on bugs and chemicals and neurotransmitters and molecules, sometimes the whole human being that is the focus can be lost. We reduce humans to bits. And this is just another example of the method of problem solving that we utilize predominantly for health issues. But we don't suggest we throw out this approach. It's only that understanding it's a partial view of what it means to be holistic. Some other intangibles that tend not to be considered with this reactive type of approach to medicine are those that aren't necessarily accounted for in most situations, like someone's diet or lifestyle or how they sleep, their activity levels, the context of their lives by understanding their whole story, their childhood experiences, traumatic events, stress management, adaptation to stress, their relationships with others and themselves, emotions, beliefs about themselves and others, so forth. The reactive model waits for people to get sick or for the numbers to change, and then with the best intentions, measures of suppression and control are used. But the reactive model comforts us with a plan. We see an enemy, whether it's a bug or it's high blood pressure, and the primary objective is to put an end to that and to track the progress of seeing that through. This is a plan that clearly identifies enemies, bacteria, viruses, pain, cancer, arterial plaques, and clear material adjustments, whether it's surgery, drugs, or even supplements. We utilize a heroic acute measure, and when that doesn't work, the next step is to increase the dose or change to a similar intervention of a similar class. Then if that doesn't work, unfortunately, sometimes that's the end of the line for options for some people in some situations. And a major reason we've gotten sicker and sicker as a society and why it's gotten unfathomably expensive is that we continue to apply heroic measures to acute and chronic problems. And this is just another example of the disconnect between what's needed in problem solving for acute, life-threatening problems versus chronic, long-term, intractable issues. And this can be thought of as the hammer analogy, how the reactive approach to medicine operates. So we've heard of Maslow's hammer analogy that if we are over-reliant on one apparent exclusive tool, such as a hammer, then everything is a nail, no matter the cost. So clear enemies and clear methods are the nails to linear, straightforward health problems. But to me, the trouble with intractable problems is that they are hard to understand, and therefore they are a lot more like screws than they are like nails. If you think about the threading on screws as the markings of the multiple complex factors that contributed to the origin of that problem, whereas the smoothness of the nail is their seemingly linear, straightforward origins. Screws do not respond well to hammering. If they eventually give way into the wood, a lot of effort and unforeseen damage sometimes has to have taken place. This damage could be seen as side effects, managing or suppressing symptoms, or not addressing root causes, therefore needing to continue to hammer screws. This type of approach is the approach of reactive medicine. So in the early months of 2020, we're presented with an emerging epidemic, which turned to a pandemic. And it's finally the nail that we've been unconsciously searching for with this approach. And the hammer mindset can go to work, locking us into place while we control the situation. It's something we can all seem to get behind because finally we have a problem that has a plan and we're in it together. And we participate in the control. And in contrast, the helplessness of situations like addiction, chronic pain, autoimmune disease may occur because the measures of control and hammering screws over time leaves us just suppressing pathology, not necessarily looking at the roots. The hammer mentality is just another example of the conditions that have disconnected us from the body, from health, and from disease. It's just a wider view of the same approach to health in general. So how does the disconnect show up? The thought goes like this. Illness is something that happens to us. It's distinctly other and separate from us. And again, the language we use to describe something reflects how we feel about it. Therefore, using non-possessive language when we're talking about illness only adds to the unconscious idea that the illness doesn't have anything to do with us as a host. Saying things like, I have the flu, the fight against cancer, this pain is killing me. When we think of something such as disease as separate from us, as a pest bothering us and not part of us, then we can implement measures of control to deal with them, like a hammer. It makes us afraid of our body, like we're flawed, that we're cursed, like someone or something is to blame because it's just happening to us. And because it's separate from us, something from outside ourselves must intervene too. And this is what we know of healthcare over the course of our lives because this is the approach, the predominant approach. And so a pattern of disconnect from the body is possible. A disconnect from health and disease is possible. We start to believe that we are disconnected from disease, that it's other from us. And that if illness just happens to us, then there is no incentive to be proactive about our own health because medicine will just be there to save us. So we end up accepting that reacting to illness is the presumed only option. We are choosing, therefore, not to also consider the ground conditions, the terrain. We have a war mentality, a crusading mentality to illness. And when we attack the bad guy as the solution, we risk missing the conditions that led to its existence in the first place. So what's the point? It's that chronic problems don't respond well to exclusive heroic measures. Chronic problems don't respond well to heroic measures as an actual solution. Heroic measures manage symptoms and keep people out of life-threatening situations. The idea is not to discard the heroic aspects of medicine, but rather to see the logic in broadening and deepening medicine with the proactive side of the continuum that address root causes as their focus. The choice between reactive and proactive medicine is a false choice. Choosing one that is superior to the other is irrelevant because they are simply different approaches within the same healthcare continuum. This is not meant to be an anti-modern medicine, anti-reactive expose. Its intrinsic value is obvious. Its contribution is immense. Conventional reactive approaches must exist for a functional society. The point is that modern medicine and all of its history is just one lens to look through. What needs to emerge at this time is a reintroduction to approaches that include and broaden this continuum of medicine. They already exist. The recognition and access of their intrinsic value to more people is the goal. There is no other major professional field where we see nearly everything through one lens like we do in medicine. And this is not a call to replace anything, but rather to broaden the view of what is possible. It's time to be aware of this lens for what it is, and then we can try on something new. So let's try on a new lens, the proactive and restorative lens. The proactive approaches tend to be the development of lifelong patterns, small, healthy inputs, such as improving the diet, your lifestyle, thought patterns, examining beliefs that we have, fostering mindful awareness, understanding the subtle mind-body connection, etc. There's so many examples. Small changes over time is the ground for transformation of yourself and your health. And why are small changes relevant? Because small changes can rapidly change complex systems like ourselves, because we are inherently complex systems. For example, small conditional changes are all it takes to start a hurricane or an avalanche out in nature, because they too are complex systems that respond to small, subtle changes to create large, unpredictable effects. So healthy or not, this is why long-term health is greatly determined by our small choices, behaviors, beliefs, and actions. So as an example, to drive this point home, a simple machine is a car. When there is a dysfunction with your car, a service is performed to that car. A part is replaced and it's fixed. But that car cannot heal itself. It has to be fixed. It has no healing capacity because it's a dead linear system. When we compare that to what we know it is to be human, we know that we're far beyond a simple system, right? The living human body can heal itself. Proof of that is apparent when you scrape your leg. No one else heals your skin other than your own system. You don't have to go to a mechanic to heal yourself. The healing is not guaranteed though. The conditions, the terrain must be such to facilitate that healing. And if you scrape your car door, it's there to stay. It's not healing itself. So the disconnect between the reactive lens of medicine and fixing the body in most situations only leads to temporary solutions, like a Band-Aid. When we solve problems of the body as if we were a simple system, it's easy just to manage disease without addressing root causes. The disconnect is why we are so advanced in medicine, yet have a situation of worsening chronic diseases. But it's important to note that modern medicine and the science behind it is not simple. However, when we reduce our study to the bits and the pieces and problem solve as if we were totally separate human parts, we can risk treating the body a lot like it is a car, like it's something that is simple. We literally replace parts of the human body routinely. This perception disconnects us from ourselves, because if we study ourselves as if we are simple and react with temporary fixes as if we're simple, then it creates a situation where our perception of our activity, our behavior, our experiences, our history all seem arbitrary. They don't seem like they matter, because ultimately it comes down to questions of dysfunction of the separate parts that medicine can handle and will fix. So now the individual seeking healing must assume that they have no say or should take a limited responsibility for their health, because it's in the doctor's hands. It strips the patient of their power of say for their own health destiny. But it also strips the power of the doctor, because when there isn't a clear enemy that fits into a reactive model of temporary management or a life-threatening situation, it becomes intractable and they become powerless and run out of options. So the incentive to be proactive is obvious, because we need to argue that our power can be reclaimed by understanding that the incentive to be proactive improves our terrain and therefore our health span. So what proactive approaches provide us with as a complex system is the best chance for a long health span. We talk about lifespan, but it's possible to live a long time, but the last couple of decades of your life weren't the same as living with freedom. Ultimately, preventing anything is just postponing it, and no one will live forever. So the idea and the incentive to be proactive for your health is to shrink your time with problems to your last couple of years instead of your last couple of decades. This is a subtle, slow play, but it's also a plan. So small choices and changes play a big part in determining your health span. So think about it. You are complex. You're a never before seen human with a completely original story. Your life as a human is the centerpiece. And considering it so is a humanistic way of seeing and practicing medicine. It's part of the proactive side, the green side. When we realize that we're a centerpiece, we can understand that not everything needs to be thought of as a search for some enemy when there are problems. But maybe it's an imbalance of the relationships to something or someone, whether it's conscious or not. When it's a question of a virus like COVID-19, it's not just the bug that's worth considering here. It's also the relationship to the host, you, your terrain. You aren't some arbitrary player in this game. You are a centerpiece of it. And it's the relationship of the bug to you that should be the focus. But with the dominant mindset, we're searching for an enemy when it could be also the person in the mirror. If you don't have the resiliency to respond to bugs appropriately, because it's about the appropriateness of your response. Too much or too little present their own problems. Because the host, your immune system, is ultimately what responds to the presence of that virus. When we focus on just one party, we are disconnected. You see the disconnection that this creates. So the case that we have is for the terrain, and the terrain is the means by which we broaden healthcare. So by exclusively demonizing the virus as an enemy, it is a convenient thing, because if we don't see ourselves in relationship to the bug, it's easy to just blame it on the bug. But like a garden, when the conditions are right, things will grow. So why a bug will seed into a disease state is not only to do with the bug itself, but also the condition of the soil. Their relationship determines the end result. If we were all the same, this virus would infect us all, and our response, our symptoms would all be identical. And medicine tries to reduce risk. Reducing risk can be thought of as the factors that decrease the chances of poor health outcomes and death. So in the context of this pandemic, what is really important to realize is that there's a difference between reducing contact with the social distancing and the quarantine with the virus, because that's an example of reducing risk with disease and death as the metric of success. So we quarantine, we separate our communities, we disconnect, and we control it, versus a proactive model where risk reduction can be thought of as increasing the health of the individual so that they are less likely to get terribly sick when they come in contact with that said virus or bug. Our healthcare system has the capacity to integrate proactive terrain-based approaches to engage in this equally valid form of risk reduction that reduces the vulnerability of millions of people in the first place. Those that are in most danger in general of this current pandemic are those whose terrain behaves in a way that becomes life-threatening based on the reaction of that bug with that state of their terrain. A different lens to try on would be an attempt to put the individual's terrain in the best possible position to respond and adapt to the stress. We also know that most bugs are our friends, that we can find all sorts of nasty pathogenic bugs in and on our bodies at most times. The reason that E. coli and Salmonella, bacteria that can cause food poisoning, can exist in our colon right at this moment without causing symptoms is because it's the other bugs present and the conditions of our terrain that keep those ill effects in check. Bugs are our great allies, including viruses. And we have to realize that bugs in our body, the bacteria and viruses, are not taking turns affecting you and interacting with you, because they're all existing together in mass by the trillions all at the same time. So for example, they've studied bodies that have unfortunately passed away from a presumed influenza and have found that the influenza virus was only found in 18% of the tissues, while any kind of viral bug was found 40% of the time in tissues. So this tells us that these bugs can be all present together and that they're all complicit in the demise of that person. So just calling it one thing that kills somebody feeds the idea that it's a single enemy that we should be fighting. It simplifies it. It reduces the situation to bits, to one enemy, without considering the interaction of that terrain with that bug and the combination of everything together. The beauty and the limitation of science sometimes is that we find what we are looking for. So if you're looking for COVID-19, you'll find it in a lot of people. The conclusions from there are up to you. So we can blame one bug, but it's really the factors of the ecosystem and the terrain and that interaction in which they live and are interacting with, which are equally worth considering. And not doing so creates a disconnect between the factors other from us and considering the power we have to contribute to our own terrain's health. And bugs constitute our micro communities within us. And we rely on them just like we do our macro communities that surround our lives on a grander scale, such as social and family support, the play, the laughter, teamwork, connection, love, togetherness. The more diversity and proportion population of our microbes that we have within us and on us, the more capacity we have for our immunity, our metabolism, our digestion, and our mental health. So not wanting to touch each other, being afraid to breathe one another's air, excessively cleaning, or turning to antibiotics at every infection is not necessarily doing us any favors, because though bugs can be problematic when they're out of balance with themselves as a population and with our terrain, they are ultimately extremely beneficial to us, and they've evolved with us, and they're our friends. And we will never eliminate bugs. It's impossible. An attempt to do so is like trying to shovel during an avalanche. So what has COVID-19 taught us? What we're seeing with COVID-19 response is that our true colors are still, of the prevailing paradigm having its grip, is still present. Our response is still that of seek and destroy an enemy. It's to control it at all costs. At this point, proactive right side of the healthcare continuum is an afterthought. And if we're not ready to admit that the reactive approach only being the sole option is limited, then when will that time be? Because this is an opportunity to finally unite the intrinsic value of both sides of the healthcare continuum and stop making it a choice. Unprecedented moments such as this serve as jump-off points for major splits in history. So maybe the terrain, maybe our soil, maybe the relationships to nutrition, lifestyle, trauma, safety, responsibility, and authenticity are more relevant than ever when it comes to health. Maybe the approaches of herbal medicine, functional medicine, acupuncture, body work, trauma work, and the like are primed to be included in a fuller spectrum of healthcare delivery alongside conventional medicine. So it's not a replacement, but a broadening and deepening of the intrinsic value of modern medicine and what it shines in. The reactive side, the heroic times, are not obsolete, just simply insufficient to deal with the growing problems of our time, the intractable problems, that the chronic disease and vulnerability of swaths of our population is not improving. They are actually worsening. So it may be a reflection of the near exclusive application of the reactive left side of the healthcare continuum, the heroic measures, to chronic imbalances that is so needing a new perspective. So let's realize the reality of the terrain while we do our best to save those that are already in vulnerable states. What kind of systems do we want in place going forward? The unprecedented situation we find ourselves in will create a grand opportunity which will change our future in many ways, including healthcare, and we participate in this vision. So using the same old hammer approach is an option, but why not open up the entire toolbox of what is possible? So now some conclusions. There is much uncertainty right now, but fear doesn't have to be the response we have. We can feel empowered. We can have incentive for proactive approaches. We can celebrate life and all the wonderful gifts and relationships that we rely on for joy and security on a daily basis. Fear is only exacerbated when we choose separation, isolation, disgust with human contact, or paranoia of our environment. It creates a disconnect. The disconnect develops from a mentality that we've talked about, that problems exclusively exist outside of ourselves and must be dealt with others outside of ourselves. So therefore, the problem and the solution are placed outside of ourselves. This situation creates a perception of powerlessness in regards to health, that we don't have a say in our own health, that we don't have a responsibility for our own health, and there aren't things to do other than react to disease. But this isn't the case. The predominant method of problem solving with health issues is combative and reactive, and it leads to a cycle of temporary fixes to long-term issues without addressing root causes sufficiently. And without addressing root causes sufficiently, we develop a paradox of brilliance in modern medicine while having increasing and worsening chronic disease burdens. We cannot ignore the terrain state that leaves us so imbalanced to start with. We can use this time to foster a world we know that we can have, one of balance, one of security and a respect for life. My name is Ben Schuff. I'm a naturopathic doctor and licensed dietitian nutritionist. Thank you so much for your time, and be well.